As a doctor working in the hospital, one of the things that annoyed me was seeing a blocked central line due to improper care. Because first of all, central lines are expensive. Secondly, they are quite delicate because they go in the big veins of the body, so any little mistake can result in a complication. It is therefore important that central lines are properly maintained. As a house officer, I had a lot of encounters with central lines because I had to give IV medication, so that was how I learned what I'm going to be telling you now. You have to make sure that the central line port is always closed when it's not in use. And if you want to give your medication, with the port still closed, you insert your syringe, then before you open it, then inject what you want to inject, then close it before you remove it to prevent any air from entry. That's one. Then secondly, you have to make sure that the central line port is always flushed with heparin saline. So I came across some patients that do not have heparin saline, and so I had to learn how to constitute one, and that is what I want to share with you today. To constitute a heparin saline, you have to get normal saline, 500 ml of normal saline, and set it aside. Then you're going to get 5,000 international units of heparin and add it to that 500 ml of normal saline. You have to confirm if that goes in your hospital. If you get 5,000 international units of heparin into 500 ml of normal saline, 5,000 divided by 500 is 10. So that gives you 10 international units
in 1 meal of normal saline.
And when you want to flush a line, you usually use 3 mils, but that depends on if the patient has any coagulation disorder or anything. But as a standard, as a rule, we usually use 3 mils of heparin saline to flush. And here is how to go about administering a medication. When you get to a central line and you want to administer medication, you're going to first of all flush with normal saline to check that the line is patent. Then you're going to go in with your medication and whatever you want to give. When you are done with that, you're going to go again with normal saline to flush. And then finally, you go in with your 3 mils of heparin saline to keep the line patent, and you lock, and that's it. And whenever you're using central line, please make sure that you double check whatever you're giving and make sure that you're very careful, because any little thing can get you into trouble. Please don't forget to properly label that bottle by writing the patient's name and writing heparin saline on the plaster, putting it on the bottle, cover the bottle properly, and store in the fridge, then use whenever needed. I hope you're able to understand what I explained. If you have any questions, let me know and I'll be sure to clarify.